Hi, I'm Dr. Dan Shapiro. I'm a plastic surgeon certified by the American Board of Plastic Surgery. I've been practicing in the Scottsdale Paradise Valley area since 1992, and that's all I do. I just perform cosmetic or aesthetic plastic surgery. I do a lot of buttock augmentation, and I do it for many reasons. And people come and ask me, Dr. Shapiro, what are the appropriate or what are the most common reasons that people present for buttock augmentation or Brazilian butt lift? I went down to Colombia probably about 8 years ago. A couple of times because I think that is the most important area, South America, for learning contouring of the lower extremities and buttock augmentation. And some of the common reasons why people come and have buttock augmentation is obviously people that want to have cosmetic enhancement of their rear ends. And why would they want to do that? Well, I think that with the current media and current emphasis on voluptuousness, that it's become very common for people to want to have more voluptuous derriere, if you will. When you think about Kim Kardashian and J-Lo and people like that, I think that isn't necessarily the standard, but that is what some people aspire to. And of course, when I do a buttock augmentation or Brazilian butt lift, it is in proportion to someone's body, and there are some ethnic considerations. So basically, if somebody is Latino or African American, I may want to do more volume than somebody who is Caucasian, unless that is something that they specifically require. Either way, I think people want more voluptuousness and more roundness and a more lifted rear end that looks more proportioned and younger. Another population or another common reason why people have buttock augmentation is obviously as we get older we lose some of that volume both in our face and in our bodies, and that is fat. So as the fat starts to dissolve, we start to see some volume depletion, and in the rear end that equates into a flatter rear end. So it is quite common for me to perform liposuction of the abdomen and the flanks, and then to process that fat and re-inject it to provide some more voluptuousness and more youthful fullness that gives proportion to areas of volume that have been lost. I think those are the two most common reasons why people may want buttock augmentation. Another reason, if someone is having liposuction of other areas of the body, we don't want to leave something out, so we want the result to be complete and look appropriate. So although a patient may not come in asking for a buttock augmentation, I may take some of the fat that I perform liposuction and rather than throw it away, I'll go ahead and inject some in the rear end to get a more youthful proportion result. I think that in my hands the fat is long lasting. It's very uncommon for me to have to go back and touch up or put more volume in, and it's a really marvelous procedure. I think the advent of fat transfer for the rear end has really revolutionized body contouring, and it's really uncommon for me to even talk about putting in solid buttock implants. So to figure out if you're a good candidate for buttock augmentation, come in for a consultation, show me some pictures of what it is that you're looking for. We'll talk about considerations with regards to proportion, with regards to something that you're looking for, whether I think it's appropriate. We'll talk about risks and complications. But the best way to get an idea about buttock augmentation, whether it's the right thing for you, is come in for a consultation. Thank you.